It's Carla, your online doctor, with today's Live in 5. Today is Tuesday, September 24th. It is 5:03 p.m. Okay, it's gorgeous here in South Florida. Starting to cool down just a little bit. This morning was actually a little cold playing tennis. My friends thought I was crazy, but that's how it felt to me. Anyway, so today let's talk about the power of laughter, specifically having to do with healthcare. Okay? If you've ever erupted into giggles simply because someone else was laughing, you know it isn't just evidence of happiness or joy. Hello, Brina. It can actually be a catalyst to putting you into a good mood. Okay, so we've all been there. You're feeling terrible, somebody comes over to you, tells a joke, or says something funny, you laugh, and your whole mood changes. Okay? Science suggests that certain kinds of humor from both healthcare providers and patients can actually facilitate healing in the body. Not only does laughter stimulate the release of endorphins, our happy neurotransmitters, hey Becky, but it is also like letting your guard down just a little bit. It shifts your body from the sympathetic nervous system, which controls your fight or flight responses, to your parasympathetic nervous system, which actually lessens fear and anxiety. Okay, the stress response of the sympathetic nervous system is an increase in heart rate and blood pressure and compromises your immune system. The parasympathetic response leads to a decrease in stress hormones and actually will lower your heart rate and your blood pressure as well, allowing the body to return to a state of calm. Okay, so all of this is good for your health. Now, humor, when used appropriately, of course, creates a human connection, which in turn results in a psychological sense of safety. Research has shown that patients create a humanizing effect when they occasionally joke about their own illness. And when healthcare providers take a similar approach to potentially embarrassing or frightening situations, patients not only feel more cared for, but less concerned with their perceived indignity. Okay? Hey, Missy. Okay, so for example, they gave an example in this particular article I was reading. A patient suffered an episode of incontinence, requiring a nurse to come clean her up. The nurse said, "What goes in must come out." And she said it in a little bit of levity in her voice, with a little wink and a smile, and the patient suddenly felt less distressed and less embarrassed. As opposed to saying, "I clean you up all the time," or "I'm used to this is my job, this is what I do." Just a little bit of levity took that edge off and made that patient feel better. In another study of how laughter affected breast cancer patients undergoing treatment, they found the patients who laughed authentically, meaning not forced laughter, experienced the fewest depressive symptoms. Okay, the most benefit was found when authentic laughter existed between two people, as opposed to a superficial relationship with a Rolodex of friends. Okay, for those of you who have no idea what a Rolodex is, just think about your Facebook friends list, right? A lot of those people are acquaintances, people you don't really know, friends of friends, that you wouldn't engage in a funny, laughing situation. You wouldn't share your deepest thoughts. You wouldn't tell them about your every medical condition, right? So sharing laughter with somebody on the periphery of your friendship isn't as intense and as beneficial to you as sharing it with somebody very close to you. So humor must be used appropriately, though. It can backfire on the patient's relationship with their doctor. Using humor by the patient to deny their own illness, almost like a sense of ignoring it, may prevent the physician from realizing the true distress the patient is experiencing. So the doctor may hear laughter and joking and ha ha ha, and I can't believe, like big deal, so I'll be throwing my guts up and losing my hair. Well, they may be saying that to lighten the mood, but at the same time they may really be hurting. So it's important for the relationship to exist between the healthcare provider and the patient before humor can actually play a really good role. Now, the goal of humor should always be to increase empathy and compassion. Okay, many illnesses require serious conversations and should remain serious and scientific. But once a bond is created and there is trust, a little levity will go a very long way. So if you have a situation where you feel like you have a comfortable relationship with your healthcare provider and you want to throw in a little levity, it's probably a good idea. I'll just give you a quick example of a situation that happened to me. For all you women out there, you're going to your gynecologist. You get in there, they make you take off all your clothes. You put on like a paper thing, which is supposed to make you feel a little bit less indecent. I'm naked except a paper piece of, strip here. And the doctor's going to come. He's going to do a breast exam. He's going to do a pelvic exam, the whole thing. And I've known this doctor for a zillion years. He delivered my daughter. We have a good relationship. So he starts to do his exam, and I looked at him and I said, with a joking face, "Aren't you going to kiss me first?" And he turned bright red but started to laugh. It lightened the mood. We all felt better. It made it much easier for everybody. That's the kind of joking that can go a really long way to making situations with a doctor very, very easy. So, try it on for size. Hello, Teresa. Hello, Susanna. You may want to have a good relationship with your OBGYN before you try my little joke, but worked for me. My doctor thought it was funny, and we had a good laugh. Anyway, hope you guys are having an awesome day. I will be back tomorrow for another Live in 5.